Well, welcome to the Cutting the Gordian Knot podcast. In the news right now is a terrible, murderous solution, or so-called solution, to our healthcare woes. So as an antidote to this ridiculousness, I'm going to offer 11 non-murderous solutions to our healthcare problems, and we will detail all of them with a little bit of setup up front. As I'm sure you heard, the CEO of United Healthcare was murdered. And unfortunately, about 10% of Americans support this, which is sick. And if you're one of them, then, well, you're going to hell. So repent now and don't go to hell. It should go without saying that if you're cheering that somebody's dad was murdered or husband or son, you're sick. And not in a way that healthcare is going to fix. So, obviously, murdering people is not the solution, but we're going to find out that this is probably the stupidest person to possibly murder if I was to add to this. And in the manifesto of the murderer, he actually admitted to not even understanding how the whole health care system market even worked. So he didn't even know that he had a solution or that this would help. And yet he went and murdered somebody. Sick and disgusting. So this wild Marxist lunatic murderer, though repeat myself with some of those, made some claims. One, that this is the largest company by market cap. No, it's not. That would be Apple at about $3.7 trillion, which is larger than all of the German stocks combined, or all of the Canadian stocks combined, which is wild. Now, United Healthcare is very big. I believe it's about $500 billion, so that would put it right behind Visa. It's like the 16th largest company. So big, but by no means the biggest. Don't be ridiculous. Further, he claimed that they're raking in record profits. And this is common. You hear this a lot from the leftist media that, oh, these companies are raking in record profits. No, they're not. We know exactly how much their profit margin is. It's 3.8%. So over the same period, McDonald's had a net profit margin of 31.8%. And let's see, so you don't think we're thinking that McDonald's is maybe recently, they're kind of ripping us off. In any case, nobody's clamoring around McDonald's saying that, oh my goodness, they're so evil. They're not. They're just making a product and they're making a very nice profit margin. United Healthcare isn't. In some periods, they're actually cash flow negative. 3.8% is not much of a profit margin. That's razor thin. The largest producer of green energy technology is actually GE, or actually green energy itself, I believe. And their net margin, 13.4%. And what's the market average? Well, that's about 8.5%, depending on what term you're looking at. Then there's the other claim that, well, this company was just having this record performance and at the cost of all the customers. Well, that's also manifestly false. And if this guy bothered to know anything, he would know that in the last year, its stock performance actually was down around 4.6%. So we actually lost value in United Healthcare. Meanwhile, the S&P 500 over the same period of time was up about 32%. So no, they're not making wild profits. And no, they're not just ballooning in massive size as the value of their company increases. They fell and they make about a third the profit, half, almost a third the profit margin of the market average. And I would add that they're also much more efficient in what they do and how they pay things out than alternatives. The alternatives being things like Medicare and Medicaid. If you guys remember back to Barack Obama, he decided to put in a law that said healthcare companies must pay out a minimum of 80% of all of their revenues. And say what you will about that, what he was trying to do is to make sure that admin cost and profit and all this other stuff didn't amount to more than 20% of all the revenues that they had coming in. Now, immediately we needed an exemption because if Medicare and Medicaid were actually held to that same standard, they would have been shut down by the government. I mean, they look like they get a little lower because, well, IRS actually collects all their revenues, so they don't need a separate revenue collection department like a private company would need. But even so, if we use that law on public insurance companies, they would be shut down by law. Some estimates at the time, and this is from memory, were that they were running around 70, maybe 75% payouts, which was way, way lower than what the private market was doing. So they are paying out significantly. Their profit margins are very small. And may I add something to this? Do the hospitals want prices to fall so that things can be much more affordable? Do they have any incentive to do that? No. They would have to shrink. They'd have to lay off staff. They'd have to cut things if they were getting less revenue. Okay, great. So they're not fighting for lower prices, are they? No. Okay. What about the drug companies? Are the drug companies fighting for lower prices? No, obviously not. They're trying to sell drugs and they want to sell them at high prices. Of course. All right. What about the consumers? Since we're in this weird insurance/health coverage model, which is now mandated on Americans, are they looking for the best price? Well, not really. We've distorted this immensely. Normally, the consumer is certainly looking for the best price. However, when we push the cost off to a third party, why would you care about price? You just care about the value, the convenience. You care that your health is being taken care of because somebody else is footing all or the lion's share of the bill. See, you don't care about prices either. Is there anybody in this whole thing? What about the government? No, they don't really care about it that much because they're fine with blowing out the deficit. And it's a political loser to say, we're going to crack down and we're going to spend less on this. No, people are worried about the value of their Medicare and their Medicaid. So that's a political loser. So the government's not terribly interested in slashing prices either. Yeah, they want to keep costs down, but if they do it too aggressively, it makes their constituents mad. So they can do very little here. Is there any group in the American economy that wants to drive down our ridiculously growing prices, which are growing something, depending on the period, 2 to 3 times faster than inflation, which is insane. In fact, the increase in healthcare cost in the last 20 years is almost solely responsible for the stagnation of real wages for United States citizens, because in our system, we have health insurance being purchased by companies, and this is a mandate for all full-time employees. Just the government said, sorry, you just have to do it. So as that rises, there's less available to pay in wages. So all of our wage increases for like 20 years pretty much explained just by the run-up in healthcare cost, because our employers didn't have enough money to give us a raise after paying this crazy run-up in prices. So the health insurance companies are the only ones trying to limit this, are the only ones trying to defend our take-home wages, are the only ones who are trying to say, hey, don't go to that hospital, don't go to that provider because they charge outrageous amounts. And then we get mad when we have to listen to them. They're not making much, guys. They are 3.8% away from being a nonprofit institution, which performs markedly better than the other nonprofits, if you call Medicare and Medicaid nonprofit, though they're technically not. They're part of the government. But, guys, if your problem is that the prices in our current system are too high, the dumbest people to blame, and I do mean the dumbest, would be the health insurance companies. And the worst person to murder would be the head of the largest one, whereby he's trying to keep costs for his company and, by extension, your employer or you lower. This is absolute insanity. Now, a few notes here on our U.S. healthcare system. One is, I want to get a myth out of the way. Some extraordinarily naive people think that we have a free market system in healthcare. That is comically false. We have the most tangled web of government meddling one could possibly imagine. We have regulations run amok. We have subsidies galore. We have restrictions of supply at almost every single stage, and this is nothing like a free market. We have the weirdest amalgamation of government top-down regulation and subsidy and state intervention and private stuff that one can imagine. It's abysmal. And I'm going to add something else. A lot of this has come down to a debate about the overall lifespan in the U.S., and I think people are barking up the wrong tree. Lifespan has very little to do with the healthcare system. Almost nothing. I searched hard for this stat, but I heard from, I believe it was a healthcare economist specifically, that when you look at the additional lifespan that modern healthcare gives us, and I mean modern by like the most modern stuff we have. So compared to simply having antibiotics, basic surgeries, maybe compared to like 1965 healthcare or something, we've added about 6 months of life. That's it. We spent 17.5% of our economy, and we've added 6 months of life. That's about it. The run-up in lifespan historically has been about, and this is not close, number one reason, we used to average in infant mortality and childhood mortality, which, if you imagine, if most people are living to 80, but every other person died sometime in childhood, which is not historically uncommon, then your average age is 40. That's not really representative of people who survived childhood. So once we got that under control, the average lifespan went up immeasurably. Also, we take out workplace accidents, war, violence, and we find the average age is yet higher. Basic sanitation, clean water, sanitary sewer systems which run away from wherever you are and your drinking water and away from the streets which they used to flow in open and uncovered. That adds a lot to your lifespan. Very little has to do with our most modern medical interventions. Very, very, very little. So let me just quote a few things here. So we have the world average, and this is all going to be for men, in part because that's a lot longer data. So the world average lifespan for men is 69.6 years. That's on average. And that's from Our World in Data. And much of what I quote is from there. They're great. It's rounded to about 70. So in the US, we're closer to 75 years. Switzerland tops the list, where they have an average age for men that reaches 81.6 years. That's quite the lifespan. And oh, what an amazing achievement we've had. Why, with all of this medical stuff, why, this is nothing like it used to be. Why, I'm sure if we consulted a couple thousand-year-old ancient text that commented on the lifespan for men, it would show that we've made incredible Oh, wait a minute. Let me read you Psalms 90, verse 10. As for the days of our life, they contain 70 years. Or, by reason of strength, 80 years. So there you go. Back in the time of the psalmist, yeah, if you survive childhood and you're not, murdered or something, if that stuff's cleared away, you're going to live about 70. Yep, right there, the text is kind of said in passing. But by reason of your strength, you could live 80. And today, the world average is 70. And in the nation which lives the longest, you get about 81.6, about 80, right? So there you go. Not much has changed, not even from way back then. So there's been lots of things which push our overall mortality up and others which move it down. I mentioned some of the basics. We can't undercount violence. Historically, about 10% of skeletons we find from the ancient world were murdered. So 10% war or murder rate. That really changes. That skews things pretty considerably. But here in the modern world, we had for a very long time the effects of smoking, which are enormous. They cut years off your life like crazy. So we have antibiotics, but we also got smoking. We certainly got way better nutrition, and that bumped things up considerably, along with a variety of other factors like average IQ. So yeah, in general, from what we can see, if you survive all the violence and whatnot, it actually nets to kind of similar. Let's read from the NIH a few of the largest risk factors which reduce your life expectancy today. Number one, it's not close. Smoking. If you are a smoker, on average, you get 13.9 less years on this earth. If you are obese, you can subtract about 4. If you are physically inactive, subtract about 3.6. If you have high blood pressure, which probably is also tracking some of the previous things, you're down about 2.4 years. If you don't eat any vegetables or fruit, if you eat a very small quantity, well, don't worry about it too much. That's only going to dip you down about 1.3, though I think that's a pretty small effect, and it could be tracking things like wealth, which I don't know if they controlled for that or not. So, really, today, when we're talking about our healthcare system, when people say, well, the American system is terrible because our lifespan is lower than other countries, say the European countries, I think they're barking up the wrong tree. That's the wrong measure because, again, healthcare does very little to change that. It's really being fat, smoking, being lazy, crashing in a car. That's another big one. And we do a fair bit of that. And I'll add something else. You also need to look at the blend of the population. For instance, if you looked in Africa, you'll find very low average ages, even amongst more wealthy Africans. Whereas if you look in Asia, you'll find much longer lifespans, even amongst poorer Asians, because it tends to be that Asians live a very long time. And white people are kind of in the middle, and black people don't seem to have as good of a lifespan, even when you control for a variety of factors. Now, in many, not all, but in many countries in Europe, they're primarily just garden variety white dudes. And that means that they're going to have average ages which reflect that. However, we have, roughly off the top of my head, 20% of our population African American. And even in the best situations, they still tend to not have as long of a lifespan as white people and Asian people. So they're actually dragging down our average, right? You can certainly see this in Social Security statistics. My goodness, they receive something like a tenth or something of what Asians do because they basically hit full retirement age and die statistically like 3 or 4 years later, whereby white people get like 2.5 times more because then they make it a little bit further. But that's another podcast. So, end of the day, for this part, I just want to say health insurance companies are trying to drive down costs. That people who compare our lifespan to Europe, it's way more complicated than they think it is. And lifespan has to do with environmental factors like, are you living in a home which smokes? It has to do with nutrition. It has to do with lifestyle. It has to do with that stuff. And it has to do with your genetics. Some groups are just going to live longer irrespective. I think there's better ways to measure that. Okay, so we're going to get to a few non-murderous principles. They're going to guide us. And I have a wonderful quote from Plato, who writes in the Laws, something I think pretty neat and should hit home, particularly for groups which are listening in and are part of like a Canadian system where it's state-run. All right, but first, I want to present something which I have presented many times before, and I think I stole from Milton Friedman. And that is the very simple 4-box chart, which looks at incentives. There are 4 possible ways that money can be spent and then benefited from. 1, you spend your own money for your own benefit. Now, in this box, you care about price. Why? Because you're spending your own money. And you care about quality. Why? Because you're the one who's getting the benefit. All right? So if we had everything like this, overall, we'll see prices will fall and we'll see the quality will rise because that's the way the incentives are set up. Now, alternatively, we could say spend our own money for somebody else's benefit. And we do that sometimes, and principally that would be something like charity. And that's a wonderful thing. But in this box, if we had to rely only on that, people care about the cost because, well, they're footing the bill. I don't really care about the quality that much, not as much as if it was them, because everybody cares more about themselves than some other person somewhere. So they care less about quality. Next up, we have spending somebody else's money on one's own benefit. This is the insurance model. Do you care about price? No, I'm spending somebody else's money. I don't care about how much it costs. It is your benefit. So I care a lot about the benefit. So what's going to happen here in this box? Well, we're going to see prices go very high and quality being pretty darn high. That kind of sums up a bit of the American system because we've shunted it into the insurance box. And it really doesn't need to be there except for maybe catastrophic insurance, because we insure weird things like regular costs, which means instead of simply covering it out of pocket, we send money to somebody else. It goes through a big system. Sometimes it gets taxed. It goes into wages. It goes into all sorts of stuff. Then it comes back to us to pay the thing that we could have paid. It doesn't make any sense. So we should really only have insurance for things that we can't pay. Obviously. I mean, you wouldn't want to get insurance coverage for your car that covers, say, filling up at the gas pump. Why? Well, because let's say it costs $100 to fill up. Well, it's going to cost something to administer your whole payment scheme. So you're going to have to spend at least $100 to go to your insurer, and the insurer's going to have to go through something to verify that you didn't indeed buy the gas, and then it's going to cost more than the $100 that you would have spent if you had just bought the gas yourself. So it wouldn't make any sense to have insurance cover the gas in your car, but it could make sense to cover the car because you might not have the money and you don't expect the expense of buying a new car if you crash. So that's what insurance ought to do. But when we apply it to everything, we get more of the problem that we've been discussing, that people run up costs very quickly. Hey, it's insuring my gas. I guess I'll just drive all over the place. Don't get the premium stuff because somebody else is paying for it. And yeah, you get high quality, but you get high costs. Okay, and then the last box. This is the box which nobody should want anything to be in. This is the worst incentive box one can imagine. Even if you are one of these, I want a socialized healthcare thing, you must at very least concede that the incentives I'm about to lay out are going to incentivize bad things, not good things. And that to the extent any system is able, we must avoid this box. What's in this one? This is where somebody else is spending the money for somebody else's benefit. So you're spending somebody else's money for somebody else's benefit. Do you care about cost? Not really. It's not my money. I don't care about it near as much as if it was my money. It's not coming out of my pocket. All right, so what's going to happen to costs? Well, they'll balloon because nobody cares about cost. All right, but you're doing it for somebody else's benefit. So do you care about quality? I mean, not near as much as I would care if it was me. So quality won't rise either. So in this box, we get neither quality nor low prices. What a stupid box. We don't want anything here. That describes like a government healthcare program. Spending somebody else's money for somebody else's benefit. We don't want those incentives. So irrespective of what you want the government to do to support the poor, we can talk about all that. There are other ways to do it. We all ought to very minimally agree that's a bad box. And that the way that we align the incentives the best, and we can get to that, but just off the go, is box number one. You spend your own money for your own benefit. Even if we have to concede that there can be public funds going to you, all right, whatever, we can get to that. But certainly, that's where the incentives need to be. Now, there's another way to characterize these, and that is that worst box. I think of that as the slave box. What does that mean? It means that you're being simply treated like you're the government's property. in the sense that they just decide what your benefit is. You don't control your own health care or anything. No, they go, no, you need this, and you're going to get that care, and you're going to arrive at this time. So your body, your health care is not your own. All right. And then your wages are not treated as your own. It's like, no, you're going to give me that money because I said so. And that's it. That's the end of the story. I'm taxing you. Your money is mine. So your money is mine. You work? No, that's mine. So you're being treated like a slave because your money is being taken away from you. And then they're just deciding how you get treated. So I call that the slavery box. They're treating you as if they are the great lords and you are simply slaves. Take your labor and they decide what you get. Slavery is bad, guys. You don't want a slavery system for healthcare. Whereas in my favorite box, you spend your own money for your own benefit. That is the freedom box. In the freedom box, you say, you know what? I get to pursue my own priorities. I get to retain my own money, spend it in the way that I see fit. And then the people who provide it say, well, I'm going to offer the things which I think would be best for my neighbor in the way that they wish to receive it. And then they meet. And then nobody's forced here. Nobody's under compulsion. They simply engage in trade when both of them benefit. That's respecting people as people, not treating them as slaves or property or just things. No, that is respecting the dignity of people on both sides, the suppliers of healthcare and the patients too. So that is the freedom box. That is the one which actually respects human dignity and doesn't treat people as slaves. So with that in mind, I want to read you something from a very, very, very old healthcare system. Here's what Plato writes in the Laws. Now you have observed that, as there are slaves as well as freemen among the patients of our communities, the slaves, to speak generally, are treated by slaves, who pay them a hurried visit or receive them in dispensaries. A physician of this kind never gives a servant any account of his complaint, nor asks for any. He gives him some empirical injunction with an air of finished knowledge, in a brusque fashion, as a dictator, and then it's off in a hot haste to the next ailing servant. That is how he lightens his master's medical labors for him. But the free practitioner, who, for the most part, attends free men, treats their diseases by going into things thoroughly from the beginning and in a scientific way, and takes the patient and his family into his confidence. Thus he learns something from the sufferers, and at the same time instructs the invalid to the best of his powers. He does not give his prescriptions until he has won the patient's support, and when he has done so, he steadily aims at producing complete restoration to health by persuading the sufferer into compliance. I've seen some funny, I don't know if they were Facebook shorts or something, which were mocking the Canadian healthcare system. And it was pretty funny. And I'm sure you can look those up. But basically, here's what it looked like. A guy walks in and the guy's like, hey, how you doing? What do you need? Here's a prescription. Get out of here. And he's like, you didn't hear my symptoms. He's like, oh, you have symptoms? All right, here's another prescription. Get out of here. Like, but my head hurts. Your head hurts. Here's a prescription. Get out of here. And he just is treating him brusquely, and he's treating him like a dictator, and everything is just finished knowledge. Okay, it's this. No, I don't think it is. I don't care. All right, get out of my office. That looks like Plato's describing. When everybody is a slave, the physician just comes in, doesn't really care about the person, doesn't ask about him, treats him in a very brusque, dictatorial manner, and is in a hot haste to get to the next place. I don't want a slave system. I don't want anybody to be a slave here. Now, contrast that with the way he looks at the free system. Amongst free doctors treating free people, we're not about just being dictators and cramming things down and being brusque and just getting it done. No, they're actually persuading the person. They're bringing them into their confidence. They're inviting their family into this. This is treating them as real people with real dignity who are actually rational, who are capable of understanding what's going on. It's a free system. So how do we get to a system where free people treat free people? Well, it's not hard. Let's stop making government mandates on how and when to care on people. Let's stop making all sorts of crazy paperwork and crazy situations which force doctors to do X, Y, and Z. Let's stop mandating on doctors and hospitals, all this stuff, and let's stop treating them like our slaves. And for certainly, my gosh, let's stop using this disgusting rhetoric of a right to health care. You don't have a right to somebody else's labor. Just saying that by virtue of me being me, I have a right for them to do what I say. Doctor, care for me. Why? Because I have a right to, you care for me. You're treating them as a slave. You don't have that right. You have a right to go to that person and provide them something that they want and see if they want to offer something back to you. And I promise they will in a free market system. So let's not treat our providers as slaves, as if we can just push them into doing whatever we want. And let's not treat our citizens as slaves, because the way the citizen is treated as a slave is the government says, all right, the workers need to be generally healthy. How do we make sure that they're generally healthy? We don't care really about their emotional state. My gosh, we don't care about their schedules. We don't have to work around that. We just need to make sure that our workers, our citizens are basically not dead and whatever, and we'll just look only at the aggregate and never at the individual. And we'll tell them what stuff they get, what services, what prescriptions we will pay for, and we will just block them from doing anything which seems too expensive to us, because they're not our citizens. They're just our slaves. They're just our little workers. We decide what's worthwhile to spend on these little creatures. They can't do that themselves. No, we decide, because at the end of the day, they're our property. Ugh. It's treating people as if they're not really people. It's treating people as slaves. You need to let people decide what is best for themselves. If they want to spend more on a particular drug, cool. If they want to spend more on a particular surgery, that's them. Let them do that. If that's their money. The government shouldn't decide when and where to deny or allow care, as if you were their property. That is sick and is anti-human. So for all these reasons, people should be treated as people, property. We should have freedom and not slavery. All right. Few other things, couple principles, and eventually, I'm sure this podcast will circle around to our non-murderous solutions, of which we haven't really covered any yet. So insurance, it does have a role, and typically, as I said before, catastrophic coverage can be good. Insurance is a kind of magical thing. Heard one economist say that it was the greatest financial invention ever made, and it is pretty wild. One of the early applications of insurance was with farms. Normally, you kind of have to hedge your bets. You don't want to just plant wheat, because what if something happened and your wheat died? You're bankrupt. No more farm. Sorry, family farm. You're gone. So instead, you would grow, say, 10 different crops, and some would do well and some wouldn't. But here's the problem. Maybe your field would have been best for wheat, but you're not doing what you're best at because you kind of have to hedge your bets. But what if people could get together and create a crop insurance program? This happened in England, and I covered it a long time ago in Think How Did the World Get Rich? As one of the answers for how the world got rich. Insurance was part of that, where individual farms said, well, I am best at growing wheat. I just need to be insured against this loss. So I'll pay some in premium, because over the long term, I will make it back, because I can grow wheat for you. And then if it fails, they get a payout and they're okay. And they're not out of the game. And if not, they're like, well, I'm glad that I guarded against the risk. And hey, even after paying the premium, I'm way ahead because I made what I can make best. So insurance is a kind of magical thing. You can't touch it. You can't feel it. You can't taste it. But it's there, and it guards against this invisible thing called risk. And it allows us to do things which make more sense in our lives by moving this risk around to the groups which can actually manage it the best or pool it effectively when we can't deal with it ourselves. So it's at its best when the price of a premium actually reflects the risk. Otherwise, it distorts incentives. And it's at its best when it covers the things which we can't afford, not the things that we can. And for the similar reasons that we laid out with the whole covering your car crash versus covering your gas tank. So we got to limit insurance to what it's best at. Insurance has a place, right? But I think we need to keep most of what we're doing in our very favorite box, where people pay for their own benefits. But that doesn't mean we can ignore that other not that bad box, whereby people pay for other people's benefits. And that's charity. And that's something we need to keep. Absolutely. My 90-year-old grandfather tells stories about how every hospital, all the doctors and nurses volunteered at free clinics. Why? Well, because we had a lot more social capital there, for one, but also because the government didn't just steamroll all of these efforts and try to monocrop some type of wild, stupid government program. And the regulations back then were very small. Just have a spot, maybe it's the hospital just after hours, and walk over as a doctor, shuffle over as a nurse, start doing your thing. You don't have to worry about all these crazy regulations, and you don't have to worry about having a giant staff of administrative nonsense. You can just go and, just care for people, and people are glad that you're doing it. We're not getting in your way. But we get in people's way now, and it's very hard to run a free clinic, which is about the dumbest thing I can imagine stopping. So, charity needs to be supported, both on a cultural level and on a legal level. All right. Then we'll get to some more stuff for charity, because we got some neat solutions. So a few of the principles, the one that we hit hard is we don't want slave-based healthcare. You are not the government's property, and you have no right to just force other people to work for you either. So the providers and the consumers of healthcare are not slaves. They're free people to be treated as free people made in the image of God. No slave healthcare. We want incentives aligned to right. Let's keep it all in the good freedom box. I would add a few more principles. One is, I think it's wrong, morally wrong, to subsidize somebody's poor lifestyle choices, and for a variety of reasons. One, let's say you're forced to subsidize somebody's poor choices. Well, I assume that you're not voluntarily doing that, at which point I see that as plain old theft. So that's wrong. You can't build a society on injustice, and that's a terrible injustice. But it's also wrong to then give that stolen money to somebody who's, say, making terrible lifestyle choices, which will result in incredible costs, which in this wild and crazy, stupid system are being transferred onto the public in large part. Now, why is this a problem? Well, it's because when we don't make people pay for the costs which they incur from poor choices, we are actually incentivizing vice. And, well, that's it. Or at very least, we're creating a bit of an attractive nuisance. Eat all the cookies you want, and don't worry, we'll cover all the costs of your obesity treatments. It's fine. At the very worst, here's how I would characterize this type of activity. I believe it's Aquinas who says that one of, if not the worst sins you can do, is actually tempting other people to sin. It's actually saying, oh no, go ahead. There's no consequences. Come on, do it. You're not going to die if you eat the apple. You're not going to die if you eat the box of donuts, right? That's super evil because it actually puts you in the place of the demonic, lying and trying to coax people into vice. It's doing the very opposite of what God wishes to do, lure you freely into making choices of virtue and developing those habits. So when we're helping people develop habits of vice by removing any consequence, I think that that is intrinsically evil. So I don't think that we should have any type system which covers all of the costs, negative behavior. That's wrong. People need to cover their own costs. That's justice. Nobody should be forced to do that. If they were forced, that's an injustice. So, obvious point, but unfortunately, it currently has no place in our system. The vast majority of spending is on people who have indeed lived egregiously unhealthy lifestyles. And that's borne by people who have taken responsibility for themselves. That's wrong. Okay, another principle. Obviously, competition drives up quality and drives down cost. Obviously. So we need competition in healthcare. Obviously. Also, here's another one. we all do, in fact, get sick and eventually die. And here's one that sounds controversial, but I really don't think it is. I think we should die with rationality and dignity, like humans created in the image of God. And that means we are made to care for others, and not only and exclusively for ourselves. And I think that if there's a giant final flurry of spending everything you have and everybody else's money all on yourself to a degree which is truly extraordinary, I don't think that's a good way to go. I would rather see a final act of self-donation than a final act of rampant consumption. And I'll outline that a little bit later. However, trying to find a source on this, and I'd have to do more digging. A lot of religious orders actually tell you up front that when you do one day die, you will get normal basic treatment. And that's good, right? We want to care for people who are sick and dying, obviously. But you won't get incredibly costly treatment. So we're going to do what we can, but we're not going to spend, say, the entire religious order's funds on getting an extra week of struggling out for life. We're going to say, you know what? God has appointed man wants to die. And we're not afraid of that. Care for the sick, care for the dying, absolutely. But there's more care than just always throwing the next drug at this person. And there's times where we have to say, no, that's all right. God has handed me this illness, and I am not afraid of it. That's great. All right, but we'll get into that later. So there's a few things. Let's get into, at very long last, our non-murderous solutions. Very first one, healthcare savings accounts for all. Let's take all government programs, all funding, all of that, and give people an account in which we put the value of their policy into that account. And I say the value of their policy because we wouldn't want to do just an even amount right now, because some people's value of their policy would be very high in that they could be covering a cancer right now. So it wouldn't be fair to just give them the same amount because that could cause some problems. So to just start this system up, we give everybody the value of what it would be like to get an insurance policy to cover given all of their current conditions. Okay. Now with that, you could buy private insurance, or you could buy something else, or you could simply have that cash and then you could spend that cash. I would also say, maybe we do a law that says all employers currently covering healthcare, which I think is ridiculous. We shouldn't even have that at all. But if that stayed, say, just allow them to request the dollar amount that you would have spent on their policy to be put in an HSA so they can spend it themselves. Because people spend things more wisely when they spend it themselves for themselves. I actually modeled this out a while ago, and I tried to find this spreadsheet, but just imagine for a moment. When do you think people spend the most on their healthcare? Obviously, it's when they're old. So if in the future, every person at birth receives a small amount from the government into a healthcare savings account, instead of funding Medicare and Medicaid, instead of providing all these tax exemptions, instead of any type of subsidy, we simply say any money we would have spent goes in an HSA. Then the amount that they use each year is incredibly small. And I actually found a table for this at one point, and I desperately want to find this. And if I do, I'll link it somewhere. For the first 60 or something years of life, it accumulates. And even at a very modest interest rate, it means that by the time they actually have to encounter significant medical costs when they're older, they have had decades of compounding interest and constant savings in these accounts, money we would have spent on people anyway. And then they're able to cover those costs and in cash. And the result is, if you compare that to the average spending per year per person, and then you look at if we had people building this up throughout their lives and then generating interest, the long and short of it is it would take about a third the amount of money paid yearly per person to fund all of the current costs that they would have in each year. Why? Well, because of compound interest. So I would move to something like that. And then if it's going to be publicly funded, I think we need incentives for good behavior, and we need to stop incentivizing people for bad behavior. Like maybe if you get to be morbidly obese, we have to reduce this because it's not fair that we keep funding you at these rates. But if you bench 2 plates or more, congratulations, you get an extra $100 a month in your healthcare savings account. I don't know. But if it's going to be pushed on the public, I think we need to do something with an eye to the incentives for each person. Otherwise, I think we're tempting people into vice and we're not rewarding people for virtue. And the goal of government is, what did Paul say? Peter say? Basically to punish evildoers and to reward the good. So if we're going to push something into the public sphere, I think we need to abide by that. Now, if we want to take it out entirely and not have the government spend any money on it, well, God bless. That sounds wonderful. But this is my reasonably practical solutions. So we also have to give people an incentive to run up the cash, to be frugal. So I think at certain thresholds, people should be able to deduct the cash. Like maybe if you have a ton and it's way over what any reasonable actuarial calculation would assume that you would need, maybe you just get to keep the cash. So if you really keep all the spending low throughout your life, hey, you got it. Or maybe you can move it into an IRA or use some of it over a certain minimum threshold to pay for things like education. Or maybe you can use it to pay for a gym membership or other things which would actually keep you healthy. So that's my first one. Healthcare savings accounts. I think they're incredible. Let's make them universal and let's fund that instead of stupid insurance policies that would be shut down if they were private under Obama's own law. That's much more efficient. It actually fits in the best box possible, and it's something we could do without raising taxes at all. I think people would be much happier. Statistically, people are much happier with HSAs of the same value versus other types of benefits. In worst case scenario, you don't like it? Cool, buy insurance with it. Whatever. You can always just revert to an insurance-based coverage system if you wanted to. So that's my first one. Certainly can do that one. It will have incredible effects, and we'll talk about a case study that relies heavily on HSAs and how magically it works out. Next one is incredibly obvious. Every other organization, every other company must actually give you a price quote. You can't hide prices if you say, I don't know, go to the grocery store. They can't be like, well, gee, we have so many things we sell here. And sometimes the fruit's older, sometimes it's younger. And how can we give you a price? No, there's just a price when you go and buy some peanut butter because it's a store, because they sell things. So they have to tell you the price. So we need, and there actually was a law put in place, and by Trump, I believe, and I don't know what happened with it under Biden. I haven't tracked it well enough, but it's an obvious common sense thing that maybe we need a price quote prior to care unless it's too urgent to actually give a quote or the person is not able to read it because, say, they're knocked unconscious. So prices work. They convey information about what people are willing to get and how willing people are to supply it. And it's absolutely necessary for a functioning system. Otherwise, you're completely flying blind about how on earth to create value. Prices, obviously, we need them. Next one. We need to remove all federal funding from any state that refuses to honor the policies approved in other states. Or as Trump would say, you need to remove the circles. There are circles around in states that stop people from being able to buy other policies, but we can't have that. We can't have it. We're going to remove the circles. No more circles. Anybody can buy from out-of-state coverage. Anybody can buy it. You get the biggest, bestest of all of the insurance coverages from any state in the union, even the state of any one of the states. I think that's pretty common sense. So typically these policies are state regulated, and I'm sorry, we should be able to honor other states. Of course. So you should be able to buy any type of policy or any type of coverage from any type of state without exception, because that's silly to just draw those little circles, if you will. And that allows us to have competition, which is a wonderful thing. Also, I don't think the government should subsidize anything, except for maybe I will give an olive branch to the nutcases who want all sorts of government intervention. Maybe. Catastrophic, unforeseeable types of insurance. So insurance against getting a wild and strange type of cancer early in life. All right, maybe they could subsidize that type of thing. Or getting some type of awful injury that's going to plague you for an incredibly long time. Yeah, maybe that. But we shouldn't be subsidizing things which are ordinary. So if we have to subsidize something, let's leave it to catastrophic coverage for catastrophic events, injuries, or illnesses only. Also, let's enforce the laws which are already on the books which govern other types of companies. And those are ones about anti-competitive practices. So no price fixing, no hiding prices, and no monopoly status should be granted. If you're a tech company, you get broken up if you're a monopoly. Not typically like 2 decades too late and in a very ham-handed fashion, but at the very least, we're supposed to all understand that monopolies aren't good. And yet we literally, legally grant monopolies to hospitals, local monopolies. It's the dumbest thing. I know I said that a bunch of things. Maybe it's like a 10-way tie. What is the dumbest thing here? But, so obviously we need to just have these companies and their companies regulated just like everybody else. No price fixing, no hiding prices, no monopoly status, allow competition to work. And the American Medical Association, which pretty much has a lock on being able to mint new doctors, I call that a monopoly too. So that either needs to be broken up or we need to allow, say, I don't know, Canada, Germany, England's, whatever their association and whatever their standards for approving doctors, I'm sure it's fine, right? I'm sure the doctors in Germany are just dandy. So let's allow people to meet those qualifications to be doctors. That's fine. We need to give these accreditation groups some type of competition. And I think that schools too. I mean, if you're trained in, I don't know, Canada or somewhere else, some reasonable developed nation, I don't see why you can't practice in the US. Seems fine to me. Also, end certificate of need laws. There are these ridiculous laws at federal and also state levels which restrict the amount of medical capacity, like restrict the amount of nurses that can be somewhere. You have to get a certificate of need written from the state to allow you to say, add new equipment or expand a building. This is nuts. We know that when you increase supply, the price falls. Obviously, that is econ one. That's like the first page of an econ textbook. So we want more supply so that the price falls. We don't want to restrict the supply and then subsidize the demand. That's a recipe for crazy prices or shortages, depending on stuff. So let's get rid of all certificate of need laws. And if any state keeps them on the book, we need to end any type of federal funding that goes to the state without exception until they withdraw those because they are awful. Okay. And then we need to end all subsidies. Why? Because in large part, much of healthcare is fairly inelastic in supply, and in part because of things like certificate of need laws. They can't just expand in order to soak up subsidy dollars. Instead, there's just only so much to go around, so you're basically just standing up in a stadium. Prices simply rise by approximately the amount of the subsidy. So stop subsidizing it because you're just raising prices. You're not helping anybody, and you're just raising taxes to pay a subsidy, which just gets transferred to the producer and typically just then gets eaten up in, say, administrative expenses, which leads me to administrative and regulatory problems and paperwork. Let's take all of these regulations and paperwork requirements and Medicare and Medicaid stuff because we shut down the insurance model and we switched it to HSAs, throw it all in a pile and burn it. And then run around chanting, I don't know, hallelujah. In just 2022 alone, the cost of hospital administration jumped 50%. This is nuts. I promise you, no patient received additional value in 2022 versus 2021 because of the 50% run-up in administrative staff. I promise you. So this is absolute just waste. And a lot of it's because we're pushing more and more regulations and stuff when instead we should burn it all and allow patients to be cared for by doctors. We're treating people, again, as slaves. No, this is the way you do it. No, you're going to fill this out. No, we don't trust you, so you need to verify these ways. No, you didn't do it the way we did, and you have no, okay, we're going to kick you off of Medicare. So, yeah, what's going to happen to your practice then? Okay, cool. You're back. Now do as we tell you. That's treating people as slaves. Allow free people to treat free people. Ditch all this paperwork, regulatory nonsense, and let people find the doctors that they value. All right. So get rid of that so we don't have all that wild, wasteful staff and administrative costs. And doctors are spending like half their time just filling out sheets which don't create value for patients. Insane. We need to end that. Next, let's let Americans buy drugs from overseas. Any reasonable developed country. If you buy something from Germany or Japan or Canada or England, it's fine. All right. They have standards which are perfectly reasonable for making sure that drugs are safe and effective. If they approve it, let's honor it. Maybe just mark it with a little German flag right there, if you're really that concerned. And if you think, oh, the Germans can't regulate drugs, you're kidding me? Then don't buy one with the German flag on it, all right? So now we'll have competition internationally for things like prescription drugs. And let's also allow, and this is kind of allowed as a bit of a Wild West telemedicine, but I think we should allow anybody who has a valid doctor, say in England, in Canada, in Australia, other English-speaking areas, would probably be able to jump into our market and provide care. Or for people who don't speak English, maybe our Spanish population might want telemedicine from Spain. Sure, I think that should be absolutely allowed. And right now, depending on the law, and I'm not an expert on some of these laws here. Oh, no, I sound like the murderer. But I'm not an expert on this specifically, but I believe depending on what they would do, that would be an unauthorized practice of medicine in the U.S., depending on what they do. I think we need to loosen that up a lot and allow competition for drugs, care, for doctors. All of that's great. It'll actually serve everybody. All right. And then finally, number 11. Number 11 is, if you are receiving any public dollars for your healthcare, I think you should have to make an end-of-life plan. And it can be whatever you want. But it, depending on the numbers, it's about 25 up to, some people have seen as high as 40% of all of your life's healthcare spending is in the last about year of your life. So it's this enormous amount of spending at the end. Now, this can be absolutely slashed when you make an end-of-life plan. Or I'm sorry, it's about 25% of your lifetime spending, but 25 to 40% reduction if you write an end-of-life plan. Here's what that could look like. You say, hey, I want all the normal treatments, and if there's crazy, super expensive experimental drugs, if it's going to add less than, say, 3 weeks to my life, and it's going to cost more than $100,000, I just don't want that. Don't worry about it. You can put that in. Or, hey, if you've resuscitated me 3 times, I don't know. And maybe something, like maybe there's a point where you say, this is where I call it extraordinary care, which we're just getting ridiculous. And that's fine. Now, as Catholics, everybody should get ordinary care, right? That's great. And we should never be trying to end somebody's life. But it's also wrong to go too far in the other direction, where we're just using up everybody's resources in order to just get some tiny marginal benefit. The thing is, right now in our current system, we kind of have 2 options, right? Well, current systems. In ours, we would just continue to get whatever marginal benefit because, well, we're not paying anything necessarily. It could be covered by insurance, so why not just go for it? It's no skin off our back. Or it could be under, say, a government plan where they just say, no, die. You have no choice. You are our slave. You are our property. Either of those I don't think are great. How about this, guys? What if, and we could even come up with ways to work this with an insurance model, we say, hey, it's going to be about $280,000 for this, which is probably about ballpark right in that last year. How about you just say, I only need the stuff which was present in the year 2000 or 2005. And that will save me approximately $180,000. And the amount that the insurance company, let's say, or my HSA, that's really simple, but say the insurance company would have paid that 280, I would like that extra 180 or maybe 90% of it or something. We can come up with some neat rules here to be sent to somebody who can't pay for a life-saving care at all, or to be sent to pregnant women in other countries so that they can have various vitamins and nutrients so that their kids won't be stunted or won't have deformities. Because 180,000 get me an extra week maybe of life, which would be pretty miserable. Or I could save, I don't know, what would that be? 10,000 kids from growing up with low IQs, birth defects, and whatnot. It's just not close. Help the other people. Or maybe, hey, I'll take that 180,000 and maybe a family who just found out that their child was born with Down syndrome. I want you to send that to them for the care of that child, which could be really expensive and they might not be able to care for. Send it to them. Or how about, you know what, I'm dying of this strange disease. You could spend an extra $500K on me, but I'd like to forfeit that extraordinary care, and I would like that money spent on curing this illness so that the next person is going to be okay. That'd be amazing. Or how about just, it doesn't even have to be medical. It could be, give me just the ordinary care. I'm not afraid of death. I want what you would have spent to go to a religious order, or to feeding the hungry, to giving water to the thirsty, clean water, or to doing any one of a variety of amazing things, right? I think that we should probably avoid it, like going directly to your kids, just in case your kids are like, come on, grandma, give us the money. That could be weird. But I think there's a lot of wonderful ways that we can give people alternatives to just using their insurance to just spend like crazy in their last year of life. And that could be an act of like final act of love in the midst of their death to bring life to others. And I think that that's incentivizing people to be incredibly Christ-like. Also, it tends to be that in the data, people who have any type of end-of-life plan, all of their family really appreciates it. Because instead of being like, all right, well, grandpa's comatose now, and what do we do? What would grandpa even want? And the normal response is, well, let's just throw everything at grandpa until we feel like, well, that was overkill. Bad choice of words. That was overdoing it. And then we'll never have to feel guilty about not doing enough ever in our life. That's what people do today. If instead we said, you know what, these were his wishes. We have it right here. Let's respect his wishes. Part of his wishes were going up to this point and not going any farther, and using all of what would have been spent on him to care for, children with birth defects or something incredible like that. That would be a lot better for everybody. Okay, so let's look over a little bit of this. The HSAs will cut the costs unbelievably. We actually only need approximately 10% of people to be price conscious in a market to move prices to somewhere around a rational level. So if we transfer all public spending into HSAs and we allow people to take the value of their policies, that's going to create a market which is all of a sudden rational, especially when we pair that with mandates on actually giving prices. If we remove any type of subsidies to the extent that we are able, and tax breaks, then we're not going to have the standing in a stadium effect, and prices will fall, which means real wages might actually go up a little bit, which they have a year or two here and there. But I promise you, they will no longer be decoupled from productivity gains, which they have been for a long time, but only if you don't include the fact that people are covering health coverage. Other than that, they pretty much approximate productivity gains, as one would have guessed. Alrighty, anti-competitive laws, con laws, all that stuff. Obviously, that's going to decrease cost overall because we're expanding supply. That's also going to mean that people can get more and better care, which is great. Then getting rid of all this crazy regulatory paperwork. We don't have, people think, well, regulation, that's written in blood. No, it's typically not. It's typically written by somebody somewhere who doesn't actually have any skin in the game. So there's no force which seems to be removing regulations. So I'm going to guess there's too much. I mean, At very least, I think things were fine in 2010. In the year 2000, things went okay in 1990. We had so much less of all of this. It wasn't even funny. And people didn't even realize any of the value of all of this spending. Okay, so we can get rid of that. End of life plan. That's going to cut by itself about 25, and by some estimates, up to 40% of healthcare spending in one shot. And we simply say you got to have it if you're taking public dollars. Like, come on. And people end up happier, and we can use some of those funds, which would have been paid for amazing causes, which I really like. We allow telemedicine, and we allow drugs from other reasonably regulated countries to compete with our stuff. Promise you, that's going to get you wildly better healthcare at a insanely lower cost. And here's my proof. The closest country to this type of model, though I still have my qualms, is Singapore. Singapore relies incredibly heavily on an HSA system, which is in large part funded publicly. So that means people actually look for value. And they do subsidize a type of like extraordinary catastrophic plan. So if something really crazy happens, there's a subsidized plan that people can have. And I believe it's an opt-out, so naturally you're going to be in. But if you don't want to participate, whatever. And that's basically the way they have it. And then they care for people who really can't pay at all. They have a system to care for the people who are most needy. So insurance, at what insurance is best at, healthcare savings accounts driving the lion's share of all of the activity here, and then make sure nobody falls through the cracks. Is that not reasonable? They also don't seem to have all of the certificate of need law stuff that we have, and they allow a lot more free market decision making. Here's the result. We spend about 17.5% of all of our economy on healthcare. Let me put that in perspective. If our healthcare spending was a country, it would be the third largest country by GDP, after obviously us, because it's a percentage of our economy, and China. It would be bigger than about 11 Australia's economies. So we spend a stupid amount on healthcare right now. Singapore spends about 5.5%. So less than a third of what we're paying. And that has risen recently because I think they've made some poor decisions recently. But for a while, 10, 13 years ago, it was 1/7 the cost of the US. Now it's about a third. So it's increased. So Singapore, keep it together. You got to continue to be my case study. But in any case, Singapore is a fraction of the cost. Is it any good? Well, in rankings that I've seen in the past, it's been number one, sometimes Hong Kong, some number one. It depends. It jockeys for position. But I simply Googled, healthcare system outcome global ranking. And as soon as I Googled that, guess what popped up once again as number one? That is Singapore. So they are ranked as the number one best healthcare system. By the way, we are number 69 after Jamaica and Armenia. So we spend way more money, and it's not that great. I mean, there's some stuff that's good. Don't get me wrong. Like America has some of the highest tech stuff because we're just throwing so much money at it, and we're just a really rich and giant and very technologically advanced nation. But Singapore in general, people like it more. It works better. The best health outcomes, and it costs only 5.5% instead of 17.5% of their GDP. So my ballpark estimate is if we did all of the things which I'm laying out, I think we could get it to about 3, maybe 4% of GDP for all of our care. If the government got out of the way, if people were non-murderous, and if people were somehow rational, and we had a free system, I think we could get it. I think we get 3 to 4% of our GDP. Personally, that's my ballpark. Singapore's at 5.5%, which is quite impressive. And at the end of the day, any policy people listening, the least you could do, take what Singapore does, copy it wholesale into American law, and let us do that. It's a third the cost, and it's the best in the world. we're really not losing anything now, are we? And it's not the only time that people just copied Singapore. 70% of all Chinese citizens live in what's called a special economic zone, which is where the Chinese looked over at Singapore and Hong Kong and said, oh, they're so rich. They're 11 times richer than us per capita at that time. They might still be. I'd have to check. Why don't we just copy all of their economic stuff? Like, why don't we just let them, do free market things and we'll still pretend to be communists? And that's what they did. I believe it was Shanghai that created the first special economic zone where they just copied everything from Singapore, which was pretty much copied from 1700s English common law regulating commerce. And they did a pretty darn good job. And then they became incredibly wealthy. And at this point, pretty much everybody's in a special economic zone. And that really explains much of the rise of China, is they were able to essentially copy Singapore. So once again, let's copy these eminently reasonable folks, do HSAs, use insurance the way it should be, allow for things like charity and free clinics. And I'll put one more thing in, which I forgot to put in. Subsidiarity. If you're a Catholic listening, congratulations. It's a doctrine of your faith. You have to believe it. And it's a wonderful thing because you should believe it. It means that problems should be solved at the lowest level that they can be solved. And that's right. So if you're sick, the answer is, who should pay for that? You. Okay, you can't do it? All right, your family. All right, well, they can't do it. Are your friends, your church, your extended family, then maybe your community, etc., groups that you're tangentially connected to, and very last, maybe your nation, and then after that, maybe something worldwide. Okay, that's subsidiarity. Let's solve problems at the lowest level possible. If we had an HSA system, you can share that. You can't share your insurance. Like if your aunt gets some terrible illness, you can't be like, hey, listen, I got Blue Cross Blue Shield over here. Let me share my insurance, aunt. No, that's not a thing. But with the HSA system, I think we should let people share. So if your dad gets sick, maybe your mom or, your grandfather or your uncle and you and your brother or sister can all pitch in from your healthcare savings accounts and care for your father. That'd be incredible. That respects subsidiarity. That means that we're not just saying everything's the government's problem. We're saying, let's solve things ourselves. Let's allow us to care for one another. And people think, oh, well, I don't want to do that. That sounds terrible. It's like, oh, listen, you're already doing that. You're already covering the costs of other people's friends and relatives because the government doesn't have money. It has your money. So the question is not, should I pay or should I not pay? The answer is, do I want to have the freedom to care for the people that God put under my care? Or do I want to just have subsidiarity entirely just trampled on and spit upon and have money just taken by force to be given to people who the government thinks is their priority? I don't like that. I think that we should allow people to have their own funds, to use it rationally, wisely, in accord with subsidiarity, and in accord with the fact that they're not slaves, they're free. There's so much more I could talk about, and there was a lot of things in here I wish I could have dug in more with the numbers, but I'm going to have to leave it here because this is long enough already. If you have any questions about this or any comments, you can email me at thegordianknot101@gmail.com. I always appreciate your emails. Also appreciate your reviews. So take a moment, stop, pull out your phone. All right, got it, cool. All right, are you in the app? All right, now go down, scroll. All right, you see the stars. Hit as many as you can. Now write why on earth you listened. Maybe it was an accident, or maybe somebody made me do it, or maybe I like the show because that would be awesome. It helps people find it. I've been a little bit too busy to make a lot of episodes, so that will help people find the ones that are out. Because apparently, if you're listening this far, you think it's a value, so share it with a friend. I definitely appreciate that. Okay, so email me, thegordianknot101@gmail.com. Any questions, suggestions, show suggestions, guest suggestions, or anything else. And don't murder anybody out there, guys. These are non-murderous solutions. And that should be all of our solutions should be non-murderous solutions. And let's hope that we can actually, as a society, have more rational conversations about this. Because honestly, pretty simple stuff, very easy to fix. Lots of great solutions to problems which just aren't that difficult to solve. Other countries have done it. We should too. Last person you should demonize are these CEOs of these insurance companies. And if you're worried that they're just fat cats and making too much money, I even have an episode about if CEOs make too much money. And the answer is, well, you'll have to listen to that episode. Thanks so much for listening to this one. God bless you all, and Merry Christmas.